let me just hearken back to a couple of the previous speakers. I'm Dave Reuben. I'm a geriatrician at UCLA, and I am the quarterback. That's what I do. That's what I tell my patients that I do. My patients are Lewis's parents, Joanne's parents, and Jonathan's parents all day long. Those are my patients. I love what I do. I look forward to going to work every day. I feel like I make a difference. I'm always fighting an uphill battle. I'd like to speak a little bit on why I love what I do and why it is so difficult. I'm a member of a 20 geriatrician group. Half of us are clinician educators and half of us are clinician scientists. I'm in the latter. I see patients a half a day a week. My colleagues who are the clinician educators do this 9 half-days a week, and we'll talk a little bit more about that. We get an hour to see a new patient. We get 20 minutes for a follow-up. We send the patients a pre-visit questionnaire that helps us move this along quicker. We all take turns covering the inpatient service. We have a Pony Express model. We do a week of this at a time. Every day at the end of the day, we send out what we call the email blast to all of our partners to tell them what's going on with their patients in the hospital. We also take night call for the entire group. That's 5 to 15 calls per night. About 80% of them are from the nursing homes. Once again, at 8 o'clock in the morning, we send out the email blast about what happened that night. I have a terrific patient services representative who is my voice and returns phone calls for me. She contacts me when there's an issue about one of my patients. By email, I send her back an email. She contacts the patients. They would rather hear from her than from me because she is so good. She's probably one of the three most important people in my life. We have no disease management program, which makes things very, very difficult. Curiously enough, the heart failure management program at our institution is not open to fee-for-service Medicare because there's no payment structure. We have no nurse practitioner. We have a 25% social worker who makes phone contact and email contact, but does not see people in person because there's no reimbursement structure for this. And what I'd like to do is, we have an electronic health record that is rudimentary at best. Basically, we have handwritten notes that are scanned in. We do have an interoperable X-ray and lab work. I'd like to talk just a little bit about what July 19th was like for me. July 19th was a typical day for me. I had a clinic in the afternoon. I had 11 patients that I saw. I had a 12th patient who it didn't show. And I actually printed out all their notes and looked at them. And they ranged from 76 to 98 years old. All but one of them were over 80. 3 of them were over 90. The 11 patients that I saw, I documented 54 problems on them. They were taking 112 medicines that I documented. They see at least 20 other physicians that I know about, many of whom are in our healthcare system, many of whom aren't. So I don't even have access to their records. I began a few minutes before 1 o'clock. I finished around 5 o'clock. There were no surprises. Nobody needed to be admitted. At the end of that, I sent emails to other physicians and the children of these patients to let them know what was going on. And then I was on call that night. And it was actually a pretty quiet night on call. I only got 4 calls. But one of the calls I got took me an hour because it was a botched transfer from a hospital to the nursing home and required 3 or 4 calls for me to get it straightened out. Our geriatricians in our group are just wonderful people. They love doing what they're doing, but frankly, they're dying on the vine. They are dying. We've done a lot to try to get them their salaries increased so that they can make as much as people at Kaiser, so they don't leave us to go to Kaiser. The reason they stay in the group is for 2 reasons. One is that they love the people they work with, and the second is they love their patients. So let me just say, do I have a minute or 2? Mm-hmm. I want to just tell you about a couple of those patients. They're very much like the patients we heard about earlier. The first was my 98-year-old patient of mine who's incredibly frail. She has 13 grandchildren, great-grandchildren, and children, and she likes to go out for lunches. She has a very advanced heart failure, and there's no disease management program, and she has the world's greatest caregiver. And if this woman did not have a great caregiver, she would be dead. But she's doing very, very well, and she likes to come to see me because she likes the ties that I wear, and she always comments on them. A second is a blind woman who is 84 years old, lives alone, has missed her last 3 appointments, doesn't know her medicine. She brought in bottles to me that had pills left in them that were prescribed 2 years ago by another provider. This is an incredibly dangerous situation. So I had to get home health and the social workers out, but it took me a long time to get that straightened out. A third patient was an 82-year-old man who has sleep apnea and COPD. I had set up a sleep study to titrate his CPAP. I had set up him to go to pulmonary rehab, and I was this is a 3-week check to see how he was doing. And he came into my office, and nothing had been done. He'd had the sleep apnea test. The results hadn't been reported, so he didn't get a CPAP. He saw the people at pulmonary rehab, but they said they put him on a waiting list. And that's when I went ballistic. That's when I started yelling and had to intervene and advocate for my patients. And the last one I want to mention is one of my favorites, is a 76-year-old physician who I care for who became profoundly depressed. He couldn't work. He was self-medicating himself with Valium. And over a period of several months, I was able to get him started on antidepressants. And at this visit, he told me he had stopped the Valium after years and years of Valium abuse. And so, you know, I felt like I was a hero, and his wife thinks I'm a saint. But in any event, this is what my life is like, and it's incredibly difficult. It requires a tremendous amount of stamina, but let me just say that you know, many physicians really want to do the right thing. It's just incredibly difficult for us. Thank you.